Embryo adoption as an effective way of treating infertility. Lots of IVF patients fail treatment partly because they've become too old, which means their egg quality is no longer very good, as a result of which they often need to resort to third-party reproduction, and lots of them will do donor egg IVF, something which people talk about a lot. But there is an additional option called donor embryo IVF or embryo adoption, which is often not discussed, and that's what I'd like to talk to you today. People know that one of the non-medical options for infertility is adoption, which means you can adopt a baby. And the beauty about adoption, of course, is it has a 100% pregnancy rate, so you don't need to go through an IVF cycle. The downside to adoption, of course, is there's long waiting lists. The reality is there aren't that many unwanted babies. As women get educated, they will terminate unwanted pregnancies, so there really aren't babies which are being handed over to adoption agencies, as a result of which wait lists are 2 years or 3 years, and it's very difficult to actually get a healthy newborn child, which means often the children available for adoption are either much older or will have some kind of physical problem, which means these are not the first choice for infertile couples to adopt. This is why it's very exciting that there is another option for adoption, which is medically and scientifically based, called embryo adoption. So you are actually adopting a baby. The only difference is you're doing it well before the baby is born. It's an in utero embryo adoption. And the beauty, of course, is that you're carrying the pregnancy for 9 months. You're bonding with the baby. It's your name on the birth certificate. And no one else in the world needs to know that you did an embryo adoption. That's especially helpful because in India, even today, adoption is still frowned upon, and you need a lot of family buy-in in order to go ahead with the adoption process. Whereas with embryo adoption, it's really a decision which only you and your husband are involved in. The good thing about embryo adoption is it's very simple because there's no need for super ovulation. You just need to do a simple embryo transfer. And pregnancy rates are extremely high because uterus is normally receptive. People have a little bit of confusion. Can my uterus accept a foreign embryo? And the reality is the uterus is an immunologically privileged site. Any woman's uterus can accept embryos from any other woman. Don't forget that even when you make an embryo in your bedroom, the embryo has 50% of genes which come from your husband, which means they're genetically foreign to you, and yet it implants. So implantation rates with donor embryos are extremely high. Success rates are extremely high. Where do these embryos come from? We don't manufacture them. These are supernumerary or spare embryos created by young infertile couples for themselves when they're going through an IVF cycle. But because they get pregnant, they're happy to donate their spare embryos to other infertile couples to help them to have a baby. Embryo adoption is anonymous, it's confidential, the donor doesn't know where the embryos are going, the recipient doesn't know where the embryos are coming from, and we're happy to do a physical match. Having said all this, it's not an easy decision. It's something which you need to be comfortable with because the reality is the genes aren't going to be yours. But at some point you need to ask yourself, do I care more about my genes or do I care more about being a mom and actually loving a child? And yes, it's common to have nightmares and fantasies when you're pregnant, especially with embryo adoption, because all pregnant women have nightmares and fantasies about what their kid is going to look like. But yours are going to be multiplied so much more because you have no idea who the couple is and what they look like. And some of that is also true even after the baby is born. But the reality is your child will talk like you and laugh like you and smile like you because you're bringing a child up. So it's a great option for infertile couples who are exploring adoption but can't find the right baby or are fed up of the waiting lists, or for couples who want to actually experience pregnancy for themselves. The beauty is there is no wait list and it's not very expensive either. No more than a regular IVF cycle with a much higher success rate. If you have questions, feel free to reach out to me. I'm Dr. Malpani. I offer a free second opinion at www.drmalpani.com. I've been an IVF specialist for over 30 years and I'm happy to help you.